In when we get to this part of the sequence, it's usually after 30 to 35 minutes of working on the posterior body. So we're gonna go over exact timing later, but I'll have warmed up the whole body by the time I get here. So, and usually done the legs, the supine legs. So the first thing I do is get the sheet a little bit out of Jesse's face, and I will, in archer's stance, just do a press. I do this press in order to stretch the shoulders out. They may have come up hunched when the client turned over. So just do a press, hold it for 30 seconds-ish. How's this pressure? It's good. Okay. Be checking in with your client. So I'm gonna start here at the pecs. Pecs can be a tender and sensitive place for people. Usually it's something I check in about in the beginning. I say with glutes too, I say, do you feel comfortable having your upper chest worked on and your hips? So instead of saying pecs and glutes, I say upper chest and hips, and kind of use this motion of signaling to the area so that people are like, you know, they know what I'm talking about. They're not like, you don't say butt, because that's like just kind of crass, I think. And then you indicate the area. So this is where I'm going to be working. Okay, the first thing I do here, it is a little bit of a warm up actually, never mind. Just warming up the area. So I take a soft fist, depending on the size of my hands, maybe I'll do some knuckles, but pecs are sensitive, so go gently, okay? And I'm gonna do this unilaterally. So unilaterally compress. One side and then the other. One side and then the other. So far we have basically 2 compressions. How's the chest feeling with these?
Feels good.
Okay. This might actually open your chest more if there's like inflammation and pain there.
Good to know.
Yeah. So the reason why I'm doing this unilaterally is because I don't want the sheet to like trap Jesse's throat. I'm going to decide which side I'm going to start on. It can really be either, but for the sake of flow, let's say I just finished the right leg and I'm coming up here, so I'm going to start with the right pec. So do you see how that kind of adds for continuity? I'm going to do my undraping here. Okay, so pinning at the shoulder, untucking the arm. Go ahead and just let it be wet like a noodle.
Okay.
Wet like a noodle? So here we go. This is oscillation. This is shaking oscillation.
Okay.
Do you see how it's like helps release tension in the shoulder girdle? Okay, and in the elbow. So I'm going to hold here and untuck the sheet. See how you're holding again? I'll just do a little jiggle. So this is what shaking is excellent for. Okay, so I'm going to untuck that. I'm going to go ahead and untuck both. Just one. I'm going to roll the sheet down just a little bit so I have access to up here. And get some product here. So maybe come up here. We're not going under the sheet. So my fist is gonna end up like a little bit outside of the sheet, like on top of the sheet. That's okay. And we're just gonna do some effleurages here. So because it's the chest, it's gonna be a little harder to get into, so you're gonna have to adjust your hand or arm tool. How's that feeling?
That's good.
So we're gonna just some effleurages here. If you are feeling any knots in here, any like areas of, you can feel an adhesion, you might come in here, get yourself, I'm just making one up at this point, and do some circular friction here. Circular friction, cross fiber friction, vibration. Oh, how was that?
Good.
Your hand is like, ooh. Feel free to move your body if you need to.
Gotcha.
I always tell my clients that if I'm working in an area and you feel like you need to kind of like shake it out, that's totally fine and really good, honestly. So here we go, there's effleurage here. It's kind of hard to knead this area, so we might just stick with effleurage and compression and friction. So we worked the pec, okay? I think I want to do a pec stretch, so we learned the stretches. And I'm keeping my hand here and kind of coming down to the side. I'm going to grab the arm, continue to shake, and put the arm into a door knocker stretch. I will put it into this stretch, and with one hand, I'll do a little bit more of like knuckle effleurage. How does that feel?
That's good. That area is usually pretty tight on me, so.
Yeah. So this could be intense for people, it could not be. You can intensify the stretch by bringing the arm up here, a little superiorly. I'm using my knuckles here, my interphalangeal joints, to work the pec. So that's a good stretch. Gonna wiggle the arm back into this position. We're gonna do supine arms. So I'm coming down to the hand and moving in a centripetal direction. So if you're going to do deep compression, deep effleurage, you might want to hold with one hand and move up the arm. So you see I'm doing some deep effleurage up the arm and then just light effleurage down the arm. So you don't want to just kind of, okay, I'm centripetal and then I'm taking my hands off and then I'm moving back to the hand. You kind of want to like be like, okay, and we're coming back here. Switch hands, see I'm in archer stance here for this effleurage. I could be a little bit more in a better stance. So here we go. So I've got oil all over, lubricant all over the client's arm, Jesse's arm. Then I'm gonna come here and say, ooh, I wanna do some petrissage. Petrissage. What kind of petrissage is this? Kneading. So I'm moving still centripetally really. I'm centripetally going this way and then just kind of briefly giving a little pinch. So centripetally, pinch, centripetally, pinch. You know, we can stay stationary with this too, work the deltoid. I'm not really going to be able to do fulling because getting on the inside of the arm is going to be like a little precarious, especially if someone has a chest. But it's also a very sensitive area. So what are we avoiding here? What is this here? So the axilla is close by. You're right. That's another area of endangerment. And what's here? Medial brachium. Medial brachium. Okay, so the bicep and the biceps brachii and the brachialis are up here, and the tricep is down here. And then right in here, there's nerves, there's vessels, there's bone. There's not a lot. There's fat. There's not a lot of like, does it feel weird when I'm pressing here?
Like a little bit.
Yeah, you don't want to press too hard here. It just is. I know when it happens for me, I get a lot of like shocks and like nerve feelings, okay? So I petrissage up here. There you go. If you find anywhere that needs a little circular friction or vibration, go ahead and do it. So I'm moving down to the lower arm. I'm gonna do some pulling here. Up and down. So since fulling is a stationary, we just go up and down, down and up. It's okay that we're moving in a centrifugal direction because it's really just here, we're doing it here, and then here, and then here. We're not like pushing blood down. Okay. Yeah. Okay. So this is another type of what stroke? Petrissage. We can get in here with, classic kneading petrissage, and I'll get you in a little deeper. How's this pressure? Notice my hips and body mechanics. Nice, 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 nice. Okay. And for the wrists and hand, I usually do the hands prone more. So prone hands. Yeah, you get in here, and are you like zoomed or? Yeah, just really get in here. I want to see all the stuff that I'm doing. So I'm gonna do this like milking, milking here. So we can do some gentle wrist traction. I know that's not something that you actually learned yet, but just some gentle traction with the wrist and the arm. So don't pull as hard as you would with the arm. So we're gonna do some gentle wrist traction. We're gonna do some milking here. Milk via all the fingers.
Which stroke would milking be considered?
Maybe an effleurage.
Okay.
It's probably a petrissage because I'm kind of like squeezing.
Yeah. Mm-hmm.
Squeezing. And at the hand, it's not centripetally. It's not a big deal. Centrifugally, we're going in that direction, but that's okay. So, there we go. And then we're gonna make our way back up. Kind of slowly, not just like hand and then one stroke up, maybe hand and then a couple strokes, and then a couple strokes. I like to actually finish with some traction, just gentle traction to put the shoulder, because if I'm like up here and I'm trying to like push with effleurage, see how the shoulder kind of elevates, I like to just kind of like take it back down. So here, we were at this side of the chest. Now we're gonna go to this side of the chest, okay? So, and I'm not going to like demo this side because it's exactly the same. So you uncover and do the same thing. What I am gonna do is do a little shaky shake. Make the bed. Make the bed for the arm. Put the arm in the bed and just cover. Okay? Do we have any questions about supine chest arms?
That it?
That's it. Well, we're gonna move to prone.
Oh,
so
okay.
you can wait for a second
All right.
if you want to. First,
Good morning.
right as fuck.
Oh, I got no eyes right now. Ooh.
You can keep them closed. Your body knows the drill. So I'm going to hold the sheet, and you're not going to touch that. And go ahead and flip and wiggle up to the top. Okay, and I'm going to put a bolster under your ankles. Go ahead and lift them up. Awesome. Is that a good place?
Got it. There we go. We're good.
And how's the face cradle?
Good to go.
There you go. Okay. So The prone arms we do in the part of the sequence, either after you've done the full back, the full posterior torso, or one side of the posterior torso. I'm gonna probably teach you the one side, we're gonna do the one side of the posterior torso, and then we're gonna come onto arms, okay? So I'm going to just undrape, well, you know what this would look like? This would look like this. So we'd have done the back or one side, and then we're coming down the, sorry,
You're good.
the shoulder to the posterior arm. So what's part of the posterior arm? The scapula. Scapula and collarbones. Okay, remember they're part of the appendicular skeleton. So, you know, we've done the back, we've done the back, we've done the back, we've done the back, we've done the shoulder up here. Ooh, that's feels intense. Sorry, we're not getting there today.
It's all good.
And now we're moving to the scapula. Okay, so the scapula. What muscles are all attached to the scapula?
Isn't there like 19 of them?
Huh?
Isn't there like 19 of them?
Attached to the scapula, probably.
Yeah.
What are the ones back here? So the posterior scapula.
Supraspinatus.
Traps.
Okay. Let's see. What is the rotator cuff? What are the rotator cuff muscles? They're the ones I'm going to be targeting here.
Supraspinatus, infraspinatus. Well, on this side. Subsepinalis.
And
Teres minor.
teres minor. Okay. So yes, here is the scapula. We got the spine right there. We got the infraspinatus, or the supraspinatus, the infraspinatus, the teres minor, and then on the inside we have the subscapularis. Right now we're just going to work on these three. So as you can see, I'm doing some effleurage here. I might be feeling something. Let's see. Let's pretend I feel. Well, you know, there's some stuff here. So I'm going to do some cross fiber friction, or sorry, some circular friction, you know, 3 to 6 times and then smooth it out. 3 to 6 times and then smooth it out. I also sometimes like to do like a double-handed friction if it's like a large spot. Okay. I'm doing some petrissage in the general area. Getting a little bit of what muscle here? Deltoid. I want to put this arm in a different position, so I'm going to free up the arm. I'm going to shake the arm. Just make sure it's nice and loose in that glenohumeral cavity. And hang it off the edge of the table. So you see what happens to the scapula? This is the inferior edge of the inferior angle of the scapula. This is the superior angle. This is the medial border. So as you can see, we've created a lot of space here. And we've also stretched out these rotator cuff muscles because they were here and now they're like all the way up here. So it can feel like a stretch to some people already. Here we go. I'm doing some assisted deep effleurage. This can be really sensitive for some people. Assisted deep effleurage. How does it feel?
Feels good.
Awesome. If I'm feeling something in here that needs to be worked on, like maybe right there, do some circular friction. 3 to 6 times and then smooth out. Or I could do some deep compression. So with adhesions or stiff points, adhesions or like areas of muscle tension, you can do friction or you can do deep compression. Okay, so we've worked there. I'm going to support the elbow, give a little shake, bring the arm to dangle off the table here. Oops. Okay. So I got a little extra oil on my hands, so I'm kind of just like really spreading it around, kind of spreading it onto the lower arm. Gonna full up here. So as I get closer to the chest, I'm going to kind of change the angle of the fulling. So I'm not catching the chest too much, or at all, please don't do it. I'm watching out for the medial brachium, which is right here. So fulling, you can intersperse whatever you're doing with some effleurage. Some petrissage here, make sure you get that deltoid. And that trap. Just get right near the elbow. Okay. We're gonna bring the arm onto the table now, supporting the elbow. I like to just give a gentle traction here. So gentle traction to kind of bring the shoulder down to like straighten out the arm. I just want to take a moment and show you how people's arms sometimes lay. Sometimes people will lay like this with their arm on the table, their elbow like this, the antecubital pointing down. Or the cubital, which one is it? I think antecubital, pointing down. This isn't really a great way to massage the arm because if you notice, as soon as I put a little pressure on it, the elbow is gonna go into hyperextension. So some people do kind of like lay like this, but you wanna encourage, kind of jiggle it around and get the elbow to kind of go into a nice relaxed state of like the antecubital, or the cubital area pointing that way, the antecubital pointing this way, so laterally and medially. So you won't be applying any pressure to the elbow joint. So I've come down to the lower arm. I'm still gonna incorporate the upper arm by doing some nice effleurages. If I have to spread more product on the lower arm, I'll do it. And then I can do some fulling here too. So I'll do it I'll full up and down the forearm. I can add some ringing here. So ringing, you can do ringing like this. And this is a little bit harder, kind of pick up the arm and go underneath and ring. This is not as easy. You can do this if you're like in a chair. Let's see, let me show you how to do it in a chair. If I was in a chair, I might be able to ring a little easier. Okay, you see that? And I like this because I can kind of just like torque the wrist a little bit, not too hard, but this helps for wrist mobilization. I can also grab here and kind of just squeeze up. How's that feel?
Good.
I like doing this actually, personally. Sitting and then just kind of like, this is what we would call stripping. Okay, so stripping is like,
Deep effleurage.
it's deep effleurage, and I'm stripping, I'm like gripping pretty hard. I'm starting at one joint, going to the next joint, and this grip allows me to get in deeper. So we wouldn't use stripping over veins that are visible. We wouldn't strip over endangerment sites. So I'm kind of like always here, I'm kind of giving a little bit of traction here. If this is too much for you, or you're not like, I'm not really down yet, just practice having the arm on the table. So we did ringing, like this. We did fulling, sorry, like this, and we can do petrissage. Again, if we feel any spots of stubborn tension or adhesions, we can do our frictions or sort of frictions. 1, 2, 3, 4, 5, 6, and smooth. Our vibrations, up to 30 seconds if we want to, but doesn't have to be, and smooth. Or we can do some compression. Okay, so we've worked all the forearm, moving on to the wrist. So this is a technique I call crack the pops, I learned this from someone who called it crack the popsicle. When you have a double popsicle with like two sticks in it, and you just like crack it. So this is, imagine the radius and ulna as the sticks, and your fingers are right in the wrist, like right in the carpals, just kind of here. So here's the head of the ulna, and the radius is a little bit more hidden, but you're going to be like here, just kind of right in the center of the carpals on the posterior wrist. So a little press up with the fingers and a little press down with the palms of the hands. So we're imagining just cracking open that popsicle gently. How's it feel? It's kind of cracking some bones in there a little bit, which is outside of our scope of practice. Maybe we'll do that same sort of thing, come down the hand. Kind of spread out the hand, and then milk. So milk, some finger traction, So this is very simple hand work. People love it when you go deep. So if I were to go deep, I'd just get in here with my thumbs, kind of feel around. But simply, if you're just trying to keep it simple and you're trying to like follow the 60-minute time, you're probably not gonna be able to spend too much time here. But I highly recommend more hand work, and you can learn it on YouTube. This is the nice hand stretch. Maybe I've showed you, maybe I haven't. I'll interlace my fingers and kind of put the tips of my fingers at the phalangeal metacarpal joints and kind of squeeze and press up. Okay, how's that feel?
Good.
And I'm gonna, I can give some wrist extension there too. That stretches that out nice and good. Make sure you're talking to the client when you're doing this. And then if you don't want to do that, you can still get the stretch in by doing this. Also be careful. How's it feel?
Good.
Cool. And then take the hand slightly off the table and stabilize with one hand while stretching with the other. Okay. You can also, if you want to work on a little bit more, you can do this interesting fist situation where you're actually turning your body. So you could kind of, you can muscle it, totally. But if you turn your body a little bit, you're using less energy. There you go. I sometimes take a whole forearm, depending on how much clients need work there. If you're working on other massage therapists, they might prefer an elbow. So just remember that. I'm gonna come back up. And that wasn't a great demo for you all, that's fine. And then just kind of like give a little bit more kind of inferior, an inferior like stretch, okay? And then come back. And where I'd be now is I'm gonna really deeply work the other side of the back and then work the arm. So that's where that would be in a sequence. All right, any questions about that? We'll just practice and I'm sure you'll have questions. All right, Jessie, thank you so much for letting me practice.